Center, which is operating with our special class integrated setting children, they are going to go ahead and start their school year on 9/8 as planned. So we are right now in the middle of trying to set busing up for all those kids that are coming back. And we got, I think in the last week, we got 3 new kids who came forward for the Gavris need. So we're getting all that contact established for that.
And for the continuing of virtual for the service coordinators who aren't doing it in person, is that their comfort level, the family's comfort level, or is it a mandate from the state?
So it's not a mandate. We had a all county conference call last Thursday, and what they did is they really stressed that teletherapy or virtual should be done to the greatest extent possible still, but they're leaving it up to the comfort level of certainly the family is the priority of the comfort level. And then service coordinators, our service coordinators are very not comfortable with doing anything in person right now. So that's where we're at.
So I don't know if from our our numbers are still very low, and given the fact that this age group would not do well with virtual, I don't know if there's any further support we could give the service coordinators to make them more comfortable to reach out to these families in person.
For sure. Yeah. I hear you. I mean, the job's getting done. We're just doing it like snail mail. We're going over things on the, via phone. I have done some in-person initial visits. I mean, we've sat outside. I'm wearing my mask. I'm trying to be as distant as possible. So, I mean, they have been getting done. I just think it's the comfort level of the other 3 younger service coordinators. And I do want to say, I think the influx of referrals really started in June when doctors' offices were starting to see more kids again. So June, July, really got a bunch of referrals coming in.
Lori, are you anticipating that as a result of the delay in the referrals, that there's going to be a bit more of a surge in referrals come late summer and fall?
Well, I definitely think it's not going to be smaller. So I definitely can see that this referral process is probably going to continue certainly through fall, for sure. This is the time of the year where, like I said, our EI kids are transitioning out. So we have 50 kids leaving, but again, the kids are coming right behind and filling those spots. And those 50 kids are going now into the preschool special education program. So we're just kind of shifting them around. So they're still around. And I think we lost about 100, and I want to say about 115 kids went to kindergarten this year. So that left preschool special education services.
And again, I just have concerns that similar to adults who are delayed medical care for 6 months and now are decompensating with chronic medical conditions, for children who had developmental issues that we didn't address for 6 months, it's going to be harder to get them back to where they even were, much less than improving, if we don't give these children what they need.
Yeah, I agree. There's only so many hours in the day, Dr. Archer.
Yeah. Okay, very good. Thank you, Lori. I guess if Janine's available, we'll go back to Janine.
Sorry about that. Technical problems, On the 8/4/20 LB warrant, we paid Beardsley Design Associates $918 for clinic engineering plans for our Dill Street building office. We paid Schneider Laboratories for lead analysis samples that were sent out. We continued to buy medical supplies through Granger for COVID-19, masks and gloves, etc. WIC purchased some office supplies from WB Mason. We have purchased some vaccines through Santa Fe Pasteur because we've begun doing immunization clinics again. So we did purchase some drugs there. We paid our regular providers for OT, PT, ST, and related services and tuition for the 3 to 5 program. And we have paid, WIC purchased a all-in-one scale through their grant money, and we also bought some testing supplies from Hach for water samples. That's all I have. Anyone have any questions?
Yeah, hi, this is Keith. What's the engineering study up for Dill Street?
When we renewed our,
To it, Janine, if you'd like.
go ahead.
Yeah. So when we had our survey for Article 28, we have to make some renovations in order to get our certificate of operations updated. And so this was the mandatory architectural review.
Yeah, right. Yeah.
And then I'll be talking a little bit more about it when I speak.
Yeah, thank you. I should have remembered that. As soon as you said that, I said, oh, right. So thank you. Thank you.
Does anybody have any other questions for Janine? If not, I'd like someone to make a motion to accept the claims.
Yeah, this is Keith. I'll move it.
I'll second.
Thank you. Anything else for Janine? Thank you, Janine. Is Eileen on?
Yes, I'm here.
All right, we'll move to Eileen if you're willing.
Okay, so hearing in consent orders, there were 4 consent orders that were sent to you. And 2 were sent with your packet, but then I believe Megan sent 2 more following the packet. I hope you got those. The first one is with Mammoth Mac Restaurant, that they were found to be not in compliance with COVID-19 guidance, which is subpart 66-3 of the New York State Sanitary Code, and also the interim guidance for food service put out by the state of New York. So everybody was standing at the bar, they weren't socially distancing. I did talk to the owner, who understood and what he needed to do in the future, and he paid a $50 penalty. The next one is with the McDonald's on Grant Avenue. They also, their employees, we observed 4 employees not wearing face coverings, which is a violation of subpart 66-3 as well as interim guidance for food service. I did also talk to the owner, and he understands. He said how difficult it is to get the employees to follow directions, but he did sign the consent order and pay a $50 penalty. The next one is the same violation, Michelle's Pizzeria, where the owner of the facility was at the restaurant and was not wearing a face covering. So they also signed a consent order and paid a $50 penalty. And then the other one that we sent to was with Voodoo's Pizza, that during an inspection in March, they had some foods out of temperature, and they also were operating for a while without a food service permit. They corrected that and paid a $100 penalty. Does anybody have any questions?
Okay, so if are there still other consent orders we need to review?
No, that's all.
Okay. Could we entertain a motion to accept the consent orders?
I'll move.
I'll make a motion.
Any opposed? Okay, so we'll accept the consent orders.
Okay.
Anything else for us, Eileen?
Yeah, so just kind of a brief update on two things. Harmful algal blooms seem to be in full swing right now.
I'm sorry, can I just ask one question on the consent orders?
Yes,
Eileen,
ma'am.
I'm sorry. What is going to be the mechanism for any repeat offenders?
We will have a hearing with the Board of Health hearing officer. So that's
Thank you.
You're welcome. Okay, so harmful algal, oh,
Eileen, I'm sorry, I'm interrupting again one more time. I know that with the executive orders with food service, we talked about the education, the observation, a consent order, and a hearing. I think for the mass gatherings, and I want to be sure that the board is on the same page about this. If there is a large gathering, that it's not a $50 fine, that it goes straight to the hearing officer. It's not a consent order. As typically they are one-time events.
Understood.
all right. Moving on then. Harmful algal blooms, that's quite widespread now over the weekend. We got a lot of calls on Owasco Lake and then yesterday as well on Cuba Lake. So we're getting a number of calls from the public, people very concerned about that, wondering when they can swim. So anyway, we're in full swing. We have been sampling, or Owasco and Auburn have sampled their water. They're sampling today, and all the data is on our website. So if you want to check and see, when we've sampled and that type of thing, you can find it right on our website. Any question on harmful algal blooms?
Yes, I've got a question relating to the sampling and the testing. It seems like this is something we're going to have to live with, at least for the foreseeable future. I'm wondering, is there any way to get any more rapid testing? We have the situation where, of course, anything that's right before the weekend, you're going to have to wait for quite a long time to get results. Our summers being what they are, essentially for the last couple of weekends, we haven't been able to use the lake. So I'm curious, is this the most rapid testing that we could get? And is this the quickest way to get information out to people to ensure that they're making good, informed decisions?
So there's two different types of tests. The test I was talking about is for the drinking water, and those tests come back within less than a day. They were taken this morning, and we'll get the results by the end of the day. When we close a bathing beach, that's a different sample. And the drinking water goes to a private lab where the city of Auburn and the town of Owasco have to pay for that. For bathing beaches, the state of New York is still sampling, or analyzing those samples. So those ones, there is a delay because they won't take them on a weekend. And that's really where the problem is. If we have to close a beach on a Friday, the lab will not take them over the weekend because they don't really feel like that's a public health emergency. As people are inconvenienced that they can't swim at the beach, but they're not going to have their people come in and work on a Saturday or Sunday. The beaches certainly have the option of taking the sample to a private lab and paying for that if they would like. But unfortunately, there is that delay for the bathing beaches for swimming. But for drinking water, I think the turnaround is pretty quick.
Well, we certainly appreciate that for the drinking water, and that's extremely important. And of course, everybody's definition of what's important or an emergency can be different. And I understand. Since, as you said, there is the option of going to a private lab. I don't, and I realize these are tight budget times, but I would advocate ensuring that whoever the decision makers of the Department of Health in the governor's office understand how important it is. And it's not just Owasco Lake, of course. It's all the lakes and the Finger Lakes. And this is not only an inconvenience for people who want to enjoy the lake, but I'm sure for business people, this can't be a good thing. So, advocating for whatever can be done to make it as quick as possible. Anyway, that's how I feel.
Okay, thank you. And one last topic, because I know we still have a very big agenda following. I was mentioned last time how busy we are, and now the state all of a sudden gave us another responsibility. So gyms now are allowed to open. They were as of yesterday, but they have to submit some information to us, and now we've been given the responsibility to perform inspections on gyms. So we don't permit gyms. We don't issue a permit generally for gyms. We do if they have a pool, because we permit the swimming pool, but we don't permit the rest of the gym. So we received a number. We created our application form, and we sent out information. We emailed all the gyms that we're familiar with, and it includes fitness rooms at temporary residences, yoga studios, all sorts of things. We searched for them, and then we got contact information and sent them email addresses. So we're getting some applications in, we're reviewing them, and hopefully some of these can open. Now, one of the biggest problems, of course, is the air handling that's required. The state requires that they have a certain level of removal capacity in the air handling, and some of the places want or have purchased those types of filters, but they just are not currently available right now. So we sent that request into the state health department saying, well, what do we do in this instance? If a gym purchased them, they can show us that they did, but they don't have them yet. And the state health department said that decision would go to the regional control group. So on whether they want to open them without that. So that's a case for a couple of our gyms, and another gym doesn't have air handling units. They just have big windows, and so again, when I checked with the state health department on if that would be acceptable with opening all the windows and putting fans in place and everything, again, they said that decision goes to the regional control group. So there is going to be some delay in opening these gyms due to that main factor of the air handling. But we'll try to get them open as soon as we can, because I know a lot of people like to work out, and it's good for us to exercise. Any questions on that?
Okay, then. Thank you, Eileen. All right, so we'll move on to Kathleen.
Great, thank you. So I gave a little list just so I wouldn't forget some of my items, but it's not nearly as onerous as it may look. Okay. So the COVID update, it's not all we do, but it's what we're doing a lot of, right, is COVID work. And it's, as you're hearing, it's very wearing on our staff, because it's this extra layer of very important public health work that we are doing in conjunction with the other important functions that we perform as a public health department. So I've been having some conversations, and I'll continue to have some conversations with our legislative oversight and some approaches we can take to try and help our staff with this burden as we move forward. So you may hear more about that at some point. Letter B, the Health Foundation. We received an application from the State Health Foundation through our NICE-HO group, which is our State Association for Health Officials. As a rural county, we were given $6,900 to put toward outreach and education efforts. So that resolution is on our September agenda to accept that funding. We just received the letter. And assuming we do, we actually will be working with some of our partners. I know Dr. Archer had been part of a conversation, the hospital and others, to perform additional outreach to more vulnerable populations within our community, and to put some bags together with some useful information and tools in a preventive method related to COVID, right? To help prevent the spread of COVID and to help identify people's temperatures and et cetera. So more to come on that, and we'll show you what those look like as we pull them together. State Department of Health has issued an opportunity with some grant funding, and I spoke a little bit about at our oversight committee, and we've had some conversation in-house. It's a significant amount of money in grant funding that has stipulations attached to it. And those stipulations really, we were reluctant to automatically jump on board and just accept the funds because we weren't certain that it was going to be the best fit for our county. We've had quite a bit of conversation, quite a bit of back and forth, and we're going to try and make that leap. And that means then that we will be attempting to use our CommCare system, which is the state system, more so than we have been. We're using it as far as transferring clients, as far as retrieving positives, as far as sending traveler information to the virtual contact tracers who are handling the travelers. But one of our biggest concerns, and Nancy may speak a little bit more to this, is we're able to provide such comprehensive education when we communicate directly, because here we are, we are the people that you see in the health department. We are the people who live in this community. And by being able to take a little bit more time to converse on the phone, we gather a lot better understanding and a lot better compliance with our isolation and quarantine. And not to say that won't happen with CommCare, but the record keeping that we had been performing directly is more holistic than what CommCare, that what we're aware CommCare provides. So we'll make an attempt to make it work, and we'll put a timeline in place. And by doing that, it will afford us some funds that we hope we can use to purchase some services of additional, I won't say staff members. We'll probably look to contract with people to work in our department to help us. So more to come as we roll that out. Guidance interpretation. That really ties in a lot with the school health and safety plans also right now, and the gym plans. It's more just to comment on the fact that the guidance keeps coming at us fast and furious, right? It's constantly changing, and sometimes we're not getting the clarity that we want, right? We know that nothing is black and white. We know that things will change. It is a real significant challenge across New York State for health departments working with our school districts, because every district has different numbers of students. Some are urban, some are rural. Different counties have different rates of infection. All we can say is we do the best we can with what we have, and the guidance may change, and people certainly right along have learned to kind of roll with it, and we're going to have to ask parents to do the same thing. One of the areas that local health departments are not necessarily in agreement with the State Department of Health is when school is in session, if a child goes home not feeling well during the daytime, that child should not come back to school without a negative COVID test, in addition to seeing their healthcare provider and et cetera. And we had some conversation with Dr. Joya and Dr. Archer on a different community call. So we know that's going to really be a challenge, right? It's going to be a challenge because of the time it may take with our national laboratories to give us turnaround time. Wadsworth is working with us to try and identify more local laboratories. Right now, for Cayuga County residents, the fastest turnaround times are with the local laboratories out of upstate and out of Cayuga Medical Associates in Ithaca. And they do specimen collection and analysis on site. And we are getting a quick turnaround time for them, but you have to be able to drive there. But our urgent care centers are ready. They've kind of been given the heads up to that they may see an uptick in needs for students to be tested. and we're pulling together a physician's update to give a reminder to all of our physicians that they may get increased calls because a child may not be feeling well and needs to have clearance to return to school. So I guess we'll kind of just keep you updated as we are our superintendents. We've had quite a few conversations with them. Our staff, particularly Nancy and Kevin, are meeting with school districts. We asked for individual meetings with each of the school districts. We've had group superintendent meetings, but we want to have more information and discussion around the particular school safety plans. So that has been happening, and we've probably had 4 or 5 conversations so far with various schools and school districts. So that is ongoing. The enforcement process, we certainly just spoke to that. Thank you for approving those consent orders. And I really, as you heard me, just wanted to be clear about the group gathering, that everybody was on the same page, because that is an issue of concern as well that we may need to address. Hopefully not. Hopefully people will act in compliance with the current executive orders. In other programs, I feel like I need to share, be more uplifting and not just be COVID. I will share with you some pictures. It was great. Tanya Young from our WIC coordinator is not on the call this month. She'll be on next month. I'll forward to you really creative approaches that her office took for the big latch on at the beginning of August. It was clever and cute, and it was well received. So we like that, keeping people engaged. And we hope to have more, upbeat and wonderful things to share with you as well. So I'll stop talking for the moment.
Kathleen, I've got a quick question. I think that the maximum numbers for the gatherings is 50. Is that right? Could you remind us of what that number is?
Correct. At this time, a gathering is 50 people or less. Yeah, and we still want to encourage face covering, certainly, and we still want to encourage social distancing.
That mandate for a maximum gathering of 50 people refers to outdoor or indoor, or does it matter?
I think that doesn't matter. I think if you're in a restaurant, and this is where I need to go back and refer to things. So a restaurant, if you're seated, may have more than 50. So the restaurant operation is at half capacity. In certain events, it's like drive-in movies or a drive-in concert. You can, if you space out your cars and people are to remain in their cars, you might have more than 50. Right? So that's not a mass gathering because you're staying inside your vehicle. Different events have slightly different take on the numbers. But if you were just say have a party in your backyard, keep it to less than 50 or less.
Kathleen, a couple things. This is Elaine. I know you said it's unclear. There's some weird guidance around golf courses because there are golf tournaments that are being planned, and I think there's probably more than 50 people, but they're potentially spreading them out in different locations. I don't even know how all that works. But when you talked about this potential funding that the department might be able to get to add resources coming with strings, and the strings are CommCare. I thought that was the software of the state. I mean, somehow it seems like if you sign on, you do it this way in lieu of in-person interactions with people. Is that sort of what you were saying?
No, it's using their system versus the system we created. So, as we all know, there was no consistent software system when this evolved, and across the state there's communicable disease electronic surveillance, there's electronic clinical lab reporting, which is really great, but there was no overarching ease of monitoring positive people and case managing them and sharing that information with other counties outside of ECLAIRS and CDES. Those are the acronyms for those terms I just used. So a few months into this pandemic, the state came out with the CommCare system. and it's had a number of updates. We as a county said, okay, we'll give it a try when they came out, and they just had too many stop and start problems. And we could not operate two systems, and we had previously, out of necessity, like many other counties, created our own method of case management and tracking patients, which I have to say I was quite impressed with the sophisticated nature of how particularly one of our nurses really knew how to use Excel and populate different spreadsheets. And so that's what we've been using in-house. And it's been a lot more comprehensive, because it's been nice if you are the person who's working Sunday, then you could come in and you could see who worked on Saturday and say, oh, yep, they said that, this patient was feeling a little under the weather. I'm going to make sure I pointedly ask, along with my regular questions. I said, no, yesterday you weren't feeling so well. How are you feeling today? Our concern is that with ComCare, we're not going to have some of that level of familiarity, right? And ease or additional notes that say, cousin to person, AB, who we've been working with earlier. There's a lot of, we know our patients really well, and we don't have that within ComCare.
But the point is, if you accept this money, ComCare comes as a mandate.
Correct.
Yeah. Thanks.
Anybody have anything else for Kathleen? Okay, thank you, Kathleen. Nancy? She was on there.
He was.
The upstate group. Oh, wait, I have
I'm
something.
sure.
Can you hear me? Can you hear me? No. Has there been any discussion with the upstate group and the CMA as to whether we could courier specimens to them and have them do the testing for us, particularly if it got to the point where we were testing a exposure, which we could batch test?
I think it's time to initiate again. We'd had some conversations with Cayuga Medical, and at that time, they could not take on more. They were focused on the southern tier and on taking on additional collections. But we certainly, it's time to make those calls again. And the same with upstate. We have not done that.
And where is Auburn Community with their supplies? Are they able to run more in-house at this point?
No, we've got our weekly call. They were waiting for some additional supply. For them, it seems to be the medium, seems to be their limiting factor. And plus, they were looking to get more supplies from Abbott, was my understanding. So we should have an update with that tomorrow.
Okay, thank you. I guess we'll move on to Nancy then.
Good afternoon. Good afternoon. I'm tired just listening to all the reports. I don't know about the rest of you. We need a nap. Anyways, let me touch base on ComCare again. ComCare came into New York. It's a company that's owned. It's from Boston. It was the system that San Francisco used, just San Francisco. New York purchased that same system. They didn't test it in a particular county or city, New York City or anything. They just put it up across the entire state. And again, they were trying to address an overwhelming problem of monitoring cases. New York didn't have any system whatsoever, so they saw the need for it. What Kathleen referred to as the CDS and eClares, which is used for all other communicable diseases, which we still use for COVID, they integrated that system with ComCare. And you can imagine the struggles around that. So there was a lot of struggles in the beginning, and there still continues to be. We are in position now, and there were 6 counties that were not for going on ComCare, and we were one of them. So we want to hear more and to see how they've refined it further. But we are in position now that they're only giving the money if you join on ComCare. And our system, even though it has gained accolades from IT here in the county for what we were able to create, if we were to have a mass of COVID cases where we would need to enlist even the state to help us manage, there would be cause that we need to get on board now while it's more quiet. So we do intend to do that. The piece that everybody just has to be aware of is which we weren't willing to give up until now. We can have immediate answers, and we can have immediate, accurate information by utilizing our system. Unlike Onondaga, our neighbor, they were still on paper. So we were even ahead of them in that regard. So I can certainly understand why they needed to move quickly on that. But we had a means by getting immediate answers, getting accurate information. And as we help people through this pandemic, it's really important to have accurate, meaningful information. So there will be, I'm not comfortable, there will not be a lag in this. And I'm going to give you an example to illustrate a case. 2 examples. We did sign up with ComCare for them to take care of our travelers. There was too many, as the states grew, there were too many for us to manage. So we thought, let's send them over to virtual surveillance to the state. And it will also give us an opportunity to see how well that is done. We get one case that's tossed back to us because it was, they stated that it was a symptomatic and a contact. So a traveler that became a contact, also symptomatic, and was also a difficult person. So we make the call, oh, she's extremely challenging. But she was not a contact, and she was not in contact or symptomatic. I contacted ComCare to find out. I wanted to understand what happened here. Well, they sent it to us because she was difficult. Well, as I've said before to everyone, everybody's grieving this, and there's going to be the element of anger. And we have to work through that. So people at ComCare, I hope they had grief counseling. I hope they've had, and they apparently have. But no, that case, they have got to become experts at dealing with angry people. So that was one case. Another case, and this is a case right in Auburn, they gave to us because this person wasn't willing to stay on the phone too long. There were children in the background. Because of the children in the background, she must be running a daycare, and that's not permissible. I call a leader at the state level to find out about this. And they said, well, and they reiterated the same information to me. I said, how did you validate that this is a daycare center? Well, we didn't, but we heard children in the background. I said, you know what, if I call this house and tell them they can't be running a daycare center, and they're not running a daycare center, we lose credibility. So this is what we have struggled against, but we are going to make the transition. But there may be some hiccups. I imagine there will be. And where we've gained a comfort that we're a reliable source of information could be a little challenging, but we will work through all of that. But that's where we sit with ComCare. And we can't run simultaneously 2 systems. And the state already has been getting all the information they need. We have to do a daily report to them at the end of each day. But we will move forward. Since last Thursday, we've had, earlier last week, we were kind of at the lowest point of positive cases that we were following than we had seen in some time. It was like, wow. And then since Thursday, we've taken up 7 positive cases and 22 contacts, all requiring intake, all requiring following, and we're continuing to do that. When it comes to guidance, as as Kathleen says, it keeps coming fast and furious. And one of the hallmarks, and we've been trying to, with our businesses, with our farms, with our schools and everyone else, that we just want to take a time out. Whenever anybody is confronted with conflict related to understanding and the interpretation of the guidance, that is bound to happen. We are going to have various interpretations. That's when we take a time out and we get the sources together and we come to an agreement on what that is. I think it's critically important that the public can look to us as a source and maybe multiple sources and the information be the same. So it's something that I've really championed about people just not fearing giving us a call, not, school administrators, whoever. Let's talk about it. Let's make sure we have this, we come to an agreement of what the same understanding for the benefit of the community. So we try to clarify, clarity and understanding. We are, vaccinations tend to be a challenge, as you well are aware. We took the COVID testing down so we could do immunizations. We've sent out to school nurses. We've sent out to administrators. We've sent, I think it was in the newspaper yesterday or today. I can't remember what day I read that. Anyways, to increase the awareness that the vaccination requirements are in force, whether your child is remotely home or they're in the classroom. And we really haven't had, we still have quite the vacancies in our vaccination clinics we've held thus far, and we know that that's not going to remain that way. And we haven't talked to the schools yet of what I did today, one school I was at, what are we going to do about virtual learners that haven't got their immunizations? Because the last thing we need is we do not need to have a meningitis outbreak with all this other going on. So more to come on that. We are working that up. We know the state is interested in hearing what we have planned for flu monitoring. How are we going to test for flu and COVID? We'll be working on that this week. We know we have positive flu cases. We have seen positive flu in the county in the last couple of weeks. We have been to, in the recent weeks, couple weeks, to farms. We've been invited to farms, and that is that's really nice. If you think about last March and a worker that didn't have any information about this, everybody was in the dark. I am really happily and somewhat a little surprised of how knowledgeable they are now and how fearful they are of the whole COVID. So been to farms, we've been to schools, we've been to businesses, etc. Just want to flip back to the state, and we learned yesterday, and then it was verified today, and I was taken back, a little surprised, that their virtual monitoring is not going to be held. Their staff is not working Labor Day, and today received they're not going to be working any of the holidays. And then it's dependent on the county to determine whether we will be doing the monitoring and so forth on holidays. I struggle with that because being in isolation and quarantine is difficult. It's a challenge for people. And we're trying to bring them into the fold with understanding, and we're trying to see and move that dial on behavioral change, helping to enlist them to try to keep in mind and keep this virus at a level that we can tolerate until we get a vaccine. And I think that includes holidays, but that's something that's going to have to be considered, and whether that is something the county legislators, what their desire is to do in that regard, I don't know. We do have one open position for a public health nurse. We have started interviews. So that will be ongoing until we get that filled. The school nurses, which was approved by the legislature, has been a significant help. No, we didn't enlist a lot of them, and we know they have full-time jobs, but the couple that we have been excellent. And when we had them also, another one worked for us in the swabbing, it was excellent. And I think we're getting another community benefit from that, is that having the persons having worked here and then be in the school system, I think they'll be really in position to really help their schools even more. We'll have another that will help. So that's been good. And I don't have anything other to, unless any of you have questions for me.
Okay, very good. Thank you. Thank you, Nancy. We'll move on to Dr. Joya.
Hello. Just this morning, I was listening to WRVO, and they're saying Syracuse University did about 13,000 saliva tests, COVID tests on their students. I guess they're probably using the Saliva Direct test that was developed at Yale. I don't know if that's what Upstate's doing with them. Seems like they're able to do it, which is a good thing. Hopefully it'll be more available in the next few weeks.
Right. You know, I did, Dr. Joy, I did cringe when I read in this morning's paper that quarterback Allen for the Buffalo Bills, he tested positive, and then the following day they did another test and he was negative. And they found that in the New Jersey place that they ran the test, that there was some malfunction of some sort, and there was 70 some tests that were negative, that were false positive. So therefore, that's how they could honor his negative second test, his rapid test. I know, I thought, oh my gosh, we'll get all kinds of calls. We do get persons that tested positive and then they want to go get another test, and they might come back and tell us they're negative now. We still have to honor that first test. We have had several occasions, and I say several, it sounds even too profound. A couple cases whereby the actual lab will call us and inform us that there's been a transcription error, there's been an issue with a result, and we will correct that, and we will inform the person, and we will take them off quarantine or isolation, etc. But I know from persons reading the article today, they'll probably go, oh, you know, because they're not going to have belief in the test. But we'll have to take that on one conversation at a time.
I do have one question, Nancy. When you talk about taking the COVID testing down and sort of focusing in on getting the kids ready and immunized for school, have you guys seen there has been an overall decrease in the number of tests being done in the community because of that? Or is it steady, or what impact of not having those drive-throughs has there been?
Well, I think that's a great question. And I think what has changed it all, because there's so much testing going on for the schools, that to get wells up, to get these schools up, that testing is taking place in those venues, that the testing the testing rates I don't think are significantly different. But it's where the testing is being done.
Okay, because I saw in one of the situational updates that some of the recent positives came from these routine testing of certain employees or asymptomatic. That's kind of what you guys said as a health department in your update, right?
Right, and now you've added on pre-surgery. Those are all tests that are now being done. So, yeah, and if you, as you well recall, we were trying to, and we still do promote at this point, unless there's a certain situation, but we really promote waiting for symptoms. We are still telling patients at this point, and we don't have any scientific information been passed along to us that tells us differently, and that is most people will be symptomatic. Most people will.
Yeah.
Mm-hmm.
Nancy, if I could ask a question too. I know I've been reading about and hearing a lot about the two different tests, the rapid test, and I believe it's called the molecular test, and the reliability of each. And it sounds like what you were talking about, Josh Allen, was taking two different tests.
That's right.
And maybe pointing to not only possibly a false positive, but also the difference and how that could cause different results in the two tests. So it seems like that's information that is not maybe generally understood in the public. Am I right in that?
I believe so. And the only thing that and I can't quote it per se in that article, but there was 70 some, and I don't remember the number, 77 tests that Boston said were done in that same lot that were inaccurate results. That's what makes that, okay, I can appreciate that and I can respect that. But that's not the typical. And Dr. Riccio can speak to this quite well because his background is pathology and so forth, of how different rapid tests can have their reliability can be different. Is that me? Can you hear me? Hi.
Anybody else have anything for Dr. Joya or Nancy? Okay, well, thank you. I guess we'll entertain a motion to adjourn the meeting.
Yeah, this is Keith. I move we adjourn.
Second.
I will second.
Thank you very much then. Thank you. And we'll see each other next month.
Thanks, everybody.
Bye-bye.
Yeah, thank you all.
Stay safe.
Bye.
Bye, everybody.